How can anxiety impact different areas of health, specifically physically? How severe can these impacts be? And ultimately, what can be done to deal with this? One thing they mention is that research shows that living with ongoing and untreated anxiety disorder can make you more likely to develop heart disease. So I specifically wanted to take a deep look at a specific model that I think can really help us grasp just the severity of the effects that anxiety can have on the human body. If someone is going through a lot of anxiety, it can really cause them to make certain decisions or lean on certain things. And so the last question I really just come to is, okay, how do we deal with it? Hey, my name is James Charpentier, and welcome to Less Than 3%, where we talk about healthcare, my journey to becoming a physician, and really anything from the perspective of a black male pursuing medicine. And in this episode, I want to get into something that may be a little bit different, but I definitely think has to do with a very pressing and prevalent issue, even just across the United States and probably really worldwide. And it's definitely an issue that a lot of people deal with, and I think it's really something that would be important to be able to address on this podcast. And I think we've been able to hint to it multiple times in a couple of different episodes perhaps, but really in this episode I want to take time to highlight specifically the issue of anxiety, which is of course a pressing current mental health issue affecting a lot of people. And in this episode I want to take the time to really think about the impact of anxiety on your health. And specifically in this episode, I want to go pretty detailed in the area of physical health. So there's a couple questions I really want to try to answer in this podcast episode. For instance, how can anxiety impact different areas of health, specifically physically? How severe can these impacts be? And ultimately, what can be done to deal with this? And for this, I want to go into a couple of different resources that I think can really help us get a really solid, holistic view when it comes to this issue and ultimately how to be able to deal with it. And the first thing I want to take a look at is a paper that was published by the Advanced Psychiatry Associates, and they go into specifically the effects of anxiety and depression on your physical health. And one of the things that I found most helpful in this article had to do with really the different health systems that are affected when it comes to dealing with anxiety. And the first thing I want to take a look at, for instance, is digestive disorders. So one of the things they bring up is that anxiety has a direct impact on your nervous system, and that directly impacts your bowels. So for instance, they bring up that chronic anxiety is associated with irritable bowel syndrome and upset stomach, which affects approximately 30% of the population. And according to this article, it's believed that about half of adults treated for IBS also have anxiety or a depressive disorder. So that really helps show how mental health can have a direct impact on physical health when it comes to the area of digestion. Another area, which I think is very important, is heart disease. One thing they mention is that research shows that living with ongoing and untreated anxiety disorder can make you more likely to develop heart disease. As they mention, while symptoms of having a panic attack can mimic those of a heart attack, anxiety can actually increase your chances of having heart problems or a stroke. So that's definitely pretty severe. Another area they bring up is in terms of asthma and breathing. They mention that if you have an issue such as chronic obstructive pulmonary disease or COPD, you could be at risk of hospitalization due to anxiety-related complications. They also mention that anxiety can even worsen asthma symptoms or also vice versa. So that really shows that even asthma can, of course, also contribute to anxiety. So there's a bit of a two-way relationship when it comes to those factors. Another thing they even mention is that stress and anxiety can impair the immune system and produce an inflammatory response. So that really just shows that there's a lot of different systemic effects that anxiety can have on the body. And to go a little bit deeper, I want to take a look at another article. This is specifically an article that was written by Christine Cherney. It's on healthline.com, and it talks about the effects of anxiety on the body. And I thought it really helped give some similar but very helpful insight. So I specifically want to take a deep look at a specific model that I think can really help us grasp just the severity of the effects that anxiety can have on the human body. And for that, I really want to take a look at the cardiovascular system in specific. And one quote that's mentioned in this article is that anxiety disorders can cause rapid heart rate, palpitations, and chest pain. And you may also be at increased risk of high blood pressure and heart disease. On top of that, if you already have heart disease, then anxiety disorders can really raise the risk of coronary events. So, of course, things such as a heart attack. And something that I thought really helped to give a deeper understanding of this is specifically a paper titled Anxiety and Cardiovascular Risk, a review of epidemiological and clinical evidence. So this really went a little bit deeper in some of the different factors and the science underlying this. And so one thing I really wanted to highlight here is really the fact that the impact of anxiety on the cardiovascular system can show up through multiple doors. What do I mean by multiple doors? So what I really mean is it has an effect, and as this paper quotes, when it comes to neurohormonal and behavioral pathways. And so in terms of neurohormonal pathways, specifically, this is dealing with the part of the nervous system that increases factors such as heart rate and contractility, which is known as the sympathetic nervous system. And so when it comes to the sympathetic nervous system, this is the part of the nervous system whereas if it's seriously activated, it's going to contribute to some of the things I just mentioned. And when it comes to from a disease standpoint, there's a couple factors that this contributes to. And for this, I want to take a quick look at the article that talks about panic disorder and chest pain, mechanisms, morbidity, and management. And one of the models they give really just has to do with the impact that a hyperactive sympathetic nervous system is going to have on the human body when it comes to issues such as panic attacks. So some of the things that they bring up is palpitations, tachycardia, so very fast heartbeat, chest pain or pressure, and symptoms such as those. And so going back into the same factor of neurohormonal pathways, if someone's dealing with a lot of anxiety and the sympathetic nervous system is seriously kicking in, this can lead to some of these factors that were just brought up, just like in the last paper that dealt with rapid heart rate, palpitations, and chest pain. Now, moving on to behavioral pathways, this is specifically talking about factors, as they mentioned in this article, such as unhealthy diet, physical inactivity, smoking, unhealthy diet, physical inactivity, and smoking really playing a role in promoting the development and clinical manifestations of coronary heart disease. So ultimately what's being said here is, as they quote, individuals with anxiety disorders are more prone to unhealthy lifestyle behaviors, which would really make a lot of sense when you think about the fact that if someone is going through a lot of anxiety, it can really cause them to make certain decisions or lean on certain things that could ultimately have a negative effect on their physical health. And so one thing that really drew from this article is the fact that it just really shows how, from both a physiological and a behavioral standpoint, anxiety can ultimately have a very negative impact on somebody's cardiovascular health. And of course, as we saw in some of the other articles, really someone's overall physical health. And so the last question I really just come to is, okay, how do we deal with it? And for this, I want to take a look at one last article that I thought really helped just bring this whole thing together. This is written by Jill Christensen, and she talks about different tips that can help to ease anxiety. And the first thing I just want to highlight is that, as we already went into throughout this podcast episode, how there are a lot of factors that anxiety can show up in, not just physically, but also emotionally. And so she mentions that symptoms such as excessive worry, fatigue, irritability, and panic attacks can happen emotionally. And also physically, you can see things like chest pain, headache, diarrhea, and increased heart rate. Now, I really want to get into the tips to combat anxiety that she mentions in this paper. I found that a lot of these are ultimately things that I think can be very, very helpful to each and every one of us when it comes to this area. Some of the things she brings up, for example, behavioral therapy, deep breathing. A lot of times, one of the things that we hear a lot about when it comes to anxiety has to do with being able to take deep breaths and concentrating. Some other things she mentions: exercise, journaling, meditation, reading, socializing, speaking with a healthcare provider, spirituality, and thought reframing. And one thing that I ultimately got from the list that she brings down here is really just the importance of being engaged. And so I would just say that really just comes down to different activities that you want to try to get involved in to really allow yourself to really be able to take care of yourself from a holistic standpoint. And I think this is especially effective if you're a student, because a lot of times there can be a lot of temptation to focus so much on just the academic side that we could potentially be dealing with a lot of anxiety as a result of that, and really just the anxiety that comes from being a student and trying to perform well. So I think it's very important that we're sure to be taking care of ourselves from a very holistic standpoint, that we're taking care of ourselves in terms of our mental health and emotionally, along with how we're doing as students. And so I just wanted to take a moment to be able to highlight all of these things and really just help us get an idea of just how severe anxiety and even chronic anxiety can really have, or really just how severe of an effect anxiety can have on our overall health. And I think this just really points to the importance of making sure that we're taking care of our mental health and the different aspects of our health altogether. Because again, as I've kind of brought up as I brought up on the podcast, I believe multiple times, is really just the idea that even just when it ties to medicine and healthcare, being a physician, it's never just as simple as someone's physical health and that's it. There's so many different factors that we always have to keep in mind. And mental health is also one of the factors that comes with that. And one of the things that I'm even thinking about when it comes to something like mental health anxiety is the fact that even as a physician, I want to be able to make sure that I'm paying attention to the different aspects that can contribute to someone's issues, which may not just be something that's on the surface physically, but could really connect to mental health issues such as anxiety. And so I think it's important that we're always looking at taking care of ourselves and taking care of others from a standpoint that's not just looking at one angle, but is considering all the different factors that can come into play. And so with that being said, that really wraps up this podcast episode. I hope you enjoyed it, and let's see what we talk about in the next one.